I've been the social services manager for just over a year, and I will get into what the county social services does, but I'm going to go backwards a step because I think explaining where I came from may help explain where I hope to help take the division with some of our community providers. And there's a call to action at the end. So, first slide up here, I moved to Los Alamos in 2020 from Pittsburgh with my husband and my 3 kids and our dog. We moved at the height of the pandemic, so driving across the country, running into gas stations, like with our masks on, me yelling at the children, like, don't touch anything, there's COVID everywhere. We got here right during the election week, so first week of November of 2020. And my oldest, my teenager, reminded me today is the 4-year anniversary of the first day home from school during that 2-week shutdown that we had March 14th of 2020. While I was in Pittsburgh, I embarked on 2 really big problem-solving challenges. The top right corner, I created a co-working space that had on-site childcare. There were several co-working spaces throughout Pittsburgh, most of them populated by men. No offense to the gentleman in the room, but the people that I knew that were freelancers at the time were doing so because they had young children, trying to manage contracts and picking up gig jobs, and needed a place for kind of on-demand childcare. And I thought, how hard can it be to start a co-working space with on-site childcare? Slightly hard. Insurance was a huge problem. But we did it, and it was really, really successful. And we had 30 to 40 members at any given time. We had childcare space down one end of the hallway, working offices and conference rooms down the other. We had a kitchen. And it was a really interesting way to think about how to make things easier for people facing this particular challenge, the childcare challenge. From that, we decided to spin off a piece of it and develop an app to help all parents find last-minute or emergency childcare. And at some point in that journey, somebody said, you should apply to a pitch competition, and that's me pitching from the stage. And then we won, and they just gave us a check. They gave us $100,000 and said, go make a software company. And I was like, oh no, I do childcare. Like, I don't know anything about tech software. But we hired those people. So how do you solve emergency childcare? How do you build trust between a parent who has an emergency need and a childcare provider? And so we were solving these big things until, as I mentioned, COVID hit, and then childcare became really, really difficult. Both co-working wasn't happening, a lot of daycare centers closed, a lot of in-home providers closed. But I wanted to share this because I think it will inform as we get to some of my last slides. So, we'll fast forward to present. This is the current social services division at the county. There are 5 of us. I should point out, Ashley and Jeremy both started in January, so we were really small, and now we're slightly bigger. If I had a clicker, but what we do is up here. And this is just a ton of boxes I threw in to show kind of the breadth of work that we do. There's a lot of boxes. It's really, really small. I'm going to go through some of the major buckets that we do. As a quick note, we are not physically located in the Muni building. We are over across from the high school. The jiu-jitsu place is in the front. The Department of Health is on one side, and we are along the other side, closest to where there used to be a Verizon and there used to be Morning Glory. So we're along that side. We see a lot of people in various states of need, and it was decided when they were making the social services department that for kind of client confidentiality, there's sometimes a lot of stigma with that some of our people feel that it would be better for them to not be in the main Muni building. We're a small town, people see, people unfortunately talk, so we're a little bit removed, but we're on the bus line, we're really, really easy for people to get to, and this is all that we do. But I thought I'd throw in some pictures to show what we actually do. So we hold community conversations This one was at Fuller Lodge to discuss some of the challenges facing our community related to opioids and overdoses. Oh, I'm sorry, not Fuller Lodge. This one's at UNMLA. We had a second one at Fuller Lodge. That's not Fuller Lodge at all. UNMLA. We do a ton of outreach. If anyone knows Jenny Bell, she's often at the farmers markets every Thursday. This was at last year's Wildfire Day. Our daughters were out grabbing 1 million Easter eggs. We work very closely with LA Cares. This is a picture I took at one of our distributions. I help pack some of the food for the kids, but it's so well organized and such a well-oiled machine every month, getting provisions out to people in need. This is the recently completed kitchen renovation at the Betty Earhart Center last June, late May, October. Time is a construct. That was a wild project, but that's the kitchen there. It is beautiful. We painted a rock for Domestic Violence Awareness Month. We work very closely with the victim's assistant, who's housed within the police department, and I'll get more to that in a minute. My daughter's there in the tie-dye. She was like, I get to use spray paint? I was like, don't puff the fumes, but she thought spray painting was so fun, and I just saw a future path for her. Spray painting train cars. Two other things, we recently set up this pantry inside our office. We have recently started, and I'll talk more about this at the end, a program to do outreach to people who are homeless or at risk of becoming homeless. And with our grant, we have now a fully stocked pantry area. We have laundry detergent, first aid kits, we have bear spray for people that are living in tents, a whole bunch of food. A lot of it can be by request. We can buy stuff, but we like to have some emergency bags on hand. We have toiletries and other supplies in there. And then we are, besides the police and the EMTs, distributor of Narcan, which can often, hopefully, reverse opioid overdoses. And so we keep a steady supply of those in our office. They are currently free if you come into our office. I think they're $50 or so at Smith's, so I'm happy to give them out to whoever needs them. One quick data chart. It is Los Alamos. We do love data. We pulled together some of our performance measures between fiscal year 22 and 23. As you can imagine, during COVID, lots of things not happening, and we've seen a huge uptick in the past couple of years. I highlighted just a couple. The number of interactions of clients going into JJAB, the Juvenile Justice Advisory Board for Resource Coordination, jumped from 379 to 2,159 appointments in 1 year. Number of visits to the Teen Center more than doubled from 14,800 to over 35,000. So not 35,000 teens, obviously, the town would be wild, but 35,000 visits that teens went in to hang out, socialize. They have an art therapy class in there. They have all kinds of stuff set up during finals week, throughout the summer programming. I just thought that was an amazing number. Number of vehicle trips provided to seniors went from 1,800 to over 2,500 just in a year. So we're here for this broad spectrum of services, right? Mental health, substance use disorder, housing and homelessness. We assist people if they have physical health needs, figuring out insurance or getting them connected to low-income providers. So those were some of the background, a little bit more specifics, like what we do. One of our functions as provided by the state is we oversee the health care assistance program. This is kind of the insurance of last resort for low-income people. There are income limits. We help people determine if they qualify and help get them enrolled. We also work with them on Medicaid applications. We can do a tiny bit with Medicare, not as much. We help get people connected to TANF, the Temporary Aid for Needy Families, SNAP benefits, WIC. They all have different income eligibility requirements, of course. It can't just be like one easy thing, but we're kind of always helping people go through them. We can also assist with if they're having trouble paying their utility bills, either help complete the application for utility bill assistance, or direct them, where to find that information. Some of our clients have varying degrees of computer savvy, and so often we are helping them complete those forms and get them submitted. We are also one of the points of contact for the county's indigent burials, and we help get health services connected for people who may be at the detention center, whether that's physical health or mental health. A big piece of what we do is the care coordination. And I put it in bold up here. We are not crisis. We are not mental health therapists. We are not here 24/7. But we're a really, really good first door for a lot of people facing needs and they don't know where else to go. And that can be any number of things. Jeremy knows because we talk about this all the time. People come in and then we help kind of peel an onion because they may come in with one thing that they think is the most pressing problem for them. And through conversations, we kind of figure out all the different things, right? The example I like to give is a client who came in concerned about how he was going to pay for his storage unit. He had a lot of his goods and possessions in a storage unit. He was no longer able to afford that monthly rent. Do we know of any services that could help pay for his storage? And we do. And so as we're talking to him about how to get connected to those, his stuff was in a storage unit because he didn't have a stable place to live, because he had been evicted, because he had lost his job. So we could very easily just say, here's where you can get help for your storage unit, best of luck, take care. But we keep peeling that onion to try to figure out all the things we can help with. Do you have health insurance? Is it because of medical bills? Do we need to help you get connected to Medicaid, et cetera, right? So we kind of piece together this constellation of help for people that may not even know the reason they came in. They needed help with one thing, and we try to help get them kind of moved along to make it feel less like a crisis. We can't make apartments appear out of thin air. We know there's a lack of affordable housing. There's a lot we can't fix, but the things that we can fix, I think we're really, really good at helping people. A lot of it involves the last bullet. There's a ton of coordination with our senior centers, with LA Cares, with self-help, with Family Council for mental health therapy, with JJAB for families that need resource coordination. We work with our community partners every day. We're in contact and trying to help. The victims assistant is up here. We work with Crystal there a lot too. Trying to do as much as we can with what we can. One of the things under our office is the County Health Council. There are a number of boards and commissions throughout the county. The Health Council is under us. And Lisa is one of our new members. I think we have 9 members currently. For the past 18 months, we've been hard at work on the 2024 Comprehensive Health Plan. The interim report is done, and then the full plan we will have ready later this fall. There will be a community health survey coming, so keep your eyes out for that coming in the mail. But it's a undertaking every couple of years to identify the gaps and resources throughout the community related to health, both mental health and physical health, and then developing a plan for social services, the Health Council, other providers to start addressing those gaps and needs. We do have some short-term recommendations that came out of the interim report, so taking those to County Council and then working to start addressing youth mental health needs kind of rose to the top, older adult needs rose to the top, some others, increasing collaboration across departments. So more to come on that. I'm presenting at County Council March 26th, if anybody wants to come and cheer me on. The other thing that the Health Council does is hear from community members to help determine some priority areas. We have a great venue. We meet once a month, and people who have identified health needs in the community can come and make a presentation. We, in December, heard from the Natural Helpers Group at the high school. They issue a survey to high school students and then learn about some of the mental health and substance use and bullying challenges at the school, and then the students themselves develop solutions to it. So the students came and presented what they've been seeing and how they've been working to build peer relationships across the school. We had a presentation on the comprehensive addiction and recovery for children or babies who are born to moms with addiction issues, and what are some methods for addressing that. We've had a whole host of presentations. So if there is something that you are very knowledgeable about and want others to be, get in contact and we'll get you on the agenda. We are also in the beginning steps of planning health resource fairs. There will be 2 coming up in May that various members are involved in. One is the Grandparents Raising Grandkids. That'll be March 10th at Northern New Mexico College. And then there will be one with LARSO for older adult needs, March 14th.
May.
Oh my gosh, I said March for both. May, yes, today is March 14th. Do not go there today, it's not there. May 10th and May 14th. Yes, you guys, seriously, I have 5/10 and 5/14 typos. The other thing that social services does is support the community safety net, for lack of a different way of phrasing it. We have a ton of contracts throughout the county, from early childhood to older adults. We work with Las Cumbres, we work with Family Strengths Network, we work with JJAB. Family Council runs the 2 youth activity centers with the 2 senior centers. We have the facilities. Las Clínicas del Norte is a medical center that shares space with the Department of Health. And each of our contracted providers, the contract that we have with them is to provide some type of community service to address a need in the community, to provide autism support services, to prevent social isolation and food stability for seniors, everything in between. One of the things I've been really focused on is how to integrate those services and resources across the safety net. Because I'm fond of saying, we use this image of a safety net, and a net has holes, right? People fall through the safety net all the time. Things are not as coordinated as we would like. All the services that we need don't exist yet, so how can we strengthen between all of our providers? So the next couple of slides are how we're doing that, and then I will end with kind of a call to action, and then questions and maybe some brainstorming. You're all fed, maybe caffeinated. It's 12:30, I don't know. Jeremy knows I'm fully caffeinated. So a couple of the things we're doing. We're doing some big community collaborations. One of them is a series of community conversations. The first one will be in April at the middle school, but it's a way of, we hope, bringing various community members together to discuss hard topics. And the tone we're trying to take is to encourage curiosity on some of these topics. The first one in April will be focused, I love the title, it's My Kid Said What? And if you're a parent, you have had that moment where you have frozen because your kid has asked about where to get condoms, and you're thinking no. Or I'm worried about a friend who's using drugs, and you're like, well, you're never seeing that friend again. Solved that problem, right? So we're looking at ways to help parents approach these conversations, maybe with some more curiosity, some more empathy. It's okay to take a pause and say, I'm not ready to talk about that yet, but give me a minute. Madly text your girlfriends and then come back. We've had, the ones we had last year were related to the opioid overdoses and how to address some of those challenges that we were seeing. And then hopefully what comes out of this is enhanced understanding among the community, but also some ideas for future programming and services. We're very involved with the Hawk Hangouts. If anybody has a middle schooler in their life, the Hawk Hangouts are a monthly event open just to middle schoolers. And the idea is to have a really fun activity with a lot of adults available and helping kind of bridge that awkwardness. I feel like I can say this, I have a middle schooler, but like awkwardness around adults so that we're building a community of askable adults. I'm not sure askable is a word, I put it in quotes, but a middle schooler may not know who to go to. They're at that weird, tricky age. Who do I talk to about whatever's stressing them, weirdness with friendships, weirdness with first boyfriend, girlfriend. So So if we're creating events like bowling or laser tag at the pond or pumpkin carving at the Posse Lodge with just some friendly adults around, I don't expect a middle schooler to ever come into my office to say, hey, I'm having trouble with my friends, can I talk? But it is so fascinating running into middle schoolers at Sugar and Cream or other places around town. They're like, hey, I know you, you were at bowling. And it's like, yes, I'm an askable adult, I am bowling. We don't sit down and talk, that's super weird. But we're trying to kind of build this foundation where middle schoolers can feel more comfortable, build those relationships among each other. Every Hawk Hangout that I attend, I'm like, I'm never doing that again. It's just chaos with 100 middle schoolers, but they're actually really, really fun. So if you're looking for a volunteer opportunity, I will bullet on this later, but come hang out with middle schoolers, it's really fun. We've also identified some needs for trainings across the community to build capacity community-wide. We have 2 trained mental health first aiders who are trained in youth mental health first aid, but I don't believe we have any currently for adult mental health first aid. And as we talk about some of the hard topics in town, how do we address kind of that low-level depression that a lot of people are still feeling 4 years post-COVID, or anxiety, or the increase in drinking, or suicide, like hard topics, we need to build the capacity within our own community. So looking to get more people trained in mental health first aid, and then thinking through a spectrum, where else can we start developing some interventions? And so one of the things we're gonna get started this fall is this nature-based guided therapy. And I think it should be therapy with a lowercase t. It's not mental health, it's not counselors, but it is training people to take a group out into nature for some guided meditation, some guided thinking. It is not going to solve anxiety with a capital A or depression with a capital D, but it may start helping, again, with that connection piece. And some of the things we thought about, for example, at Family Strengths Network, parents meet there and there's room for kids to play, but what if those parents, as kind of a support group, could go out on the trails and have kind of a guided session? If you are a parent of a kid with any neurodivergent need, there can be a lot of feelings of shame around that. Your kid's the wild one at the grocery store, your kid's the one getting notes sent home from school. Let's take that group of kids out on the trails and see if there's a different way of bonding with them. JJAB runs a really successful series called One Circle that happens at lunches at the middle school and high school. Trained facilitator bringing a group together around specific kind of social, emotional issues. There are a lot of kids who would not be caught dead at lunch meeting in this kind of group, but they would go out on the trails with the same guided facilitator, right? And so kind of building, again, additional capacity to reach more people in a different setting. I could have like 3 more slides on community collaborations. It's the best part of this job. What we are tasked with specifically is addressing gaps and trends, especially as emergency needs come up. So there were a series of overdoses and deaths last spring related to opioids. Several were related to fentanyl in illicitly bought drugs. At least one was related to a medication-related overdose, like not illegally or not purchased from somebody else. So our office became the go-to point for the county, as I mentioned, just receiving and distributing Narcan, setting up trainings around the county, and then kind of coordinating between the police, the courts, the schools, other community partners. I wrote these down because I didn't put the stats up here, but we, from June to October, held 7 trainings and trained more than 200 people in how to respond to an opioid overdose. We had a separate youth summit just for high schoolers, and we had 110 high schoolers come to SALA to get this information. I really was hoping for like 25. I was like, no one's gonna come and it'll be terrible on a Tuesday night, and 110 high schoolers came. We only had 80 seats set up, it was amazing. In that same time period, we distributed over 700 boxes of Narcan by, again, kind of making a plan across the community. So we had them at the farmer's market, we had them at the summer concert series, right? A really low stigma way to just, as you're going around and picking up swag, grab a box of Narcan, no questions asked. We trained all of the library staff, so both libraries, White Rock and Mesa, have Narcan available, and all librarians are trained to recognize and respond to an overdose. And both visitor centers in White Rock and Los Alamos also have Narcan available. So that was, I thought, a huge success. We also, as I mentioned earlier, received a grant to address homelessness in the county. I have more times than I can count been asked, but we have homeless people in Los Alamos. And yes, we have a number of people who are homeless. We maybe don't have bridge overpasses with tents like you see in Philadelphia or DC or big cities, but we have people living in tents in our canyons. We have people living in their cars or in RVs in a driveway with an extension cord snaked out. We have a number of people that we call housed by the grace of others, that are couch surfing. So you're not on the lease, you're not on the mortgage, you could be asked to leave at any time, but they're sleeping in someone's basement or in their spare room. And part of the community collaboration piece is also figuring out where people may be better connected than with social services and how we can connect them. So we have a partnership with LARSA, with the senior centers, because they see maybe a totally different group than we see at social services. So are there people coming in for meals 5 days a week or getting home delivered meals that are facing housing instability, and how can we work together? We have the same relationship with JJAB because they see families of kids under 18. If they're coming in for a mental health referral, but we also ask about housing instability, how can we then get them connected and build them into our system? I would say at any given time we have 20 to 30 people that we are working with that are in various stages of not stable housing, whether sleeping outside or sleeping, at a place that is not theirs. I would say 4 to 6 of those are people over 60 that have faced rising apartment costs, rising prices, medical bills that they can't afford, that has caused them to become homeless. We're working, JJAB, I think we have about 6 families we are working with. And Jeremy was hired specifically through this grant to work with people who are homeless or at risk of becoming homeless. And part of what we've talked a lot about is collecting those stories, right? The families referred to us from JJAB, several of them are women who are currently homeless because they are seeking divorce, and they have been stay-at-home moms. They have moved out here with their spouse. That husband has decided to keep the house and cut her off financially or from cell phones or cars or other things. And so how do you find affordable housing on a single mom income? We know what the housing situation is like here. How do you find one with enough space for 2 or 3 or 4 kids? How do you navigate this while dealing with lawyers and, right? So some of the stuff we can provide, again, is not magical housing, but we have lots of gift cards. We can help with Smith's gift cards, we can help with Speedway gift cards. One of the other families has a child with an emergency medical need and has been driving to and from Albuquerque every week. And if you think about if you're working hourly, taking time off work so you're not getting paid, and suddenly you have an extra $100 in gas every week, for people on the margin, that's a lot, right? So can we help with Speedway gift cards? It's not gonna solve it, but can we do some harm reduction in the meantime? Can we provide groceries, Subway gift cards, etc.? So that's been one of those other partnerships. I am working with, to build some regional partnerships with my counterparts in Santa Fe and Rio Arriba counties. The news just came out last week, Espanola is setting up a social services division, so I will be snagging that person to join our group as soon as they get that person hired. And then, like I mentioned, the Youth Summit, so working with the schools and some other groups, that was part of the Key Club to reach kids in wherever we can. Quickly timed. What I really see as our charge is imagining a stronger safety net. We are deeply guided by person-centered services. We ask the person, what do they think the priorities are? How do we help with what their emergency need is? More than once, we've gotten people who have refused our food bags, but asked about pet food for their pet, right? And everything in me is like, okay, but like, can you please just take this can of beans? And they're like, no, but I'm worried about this, right? And we totally get that. We try to approach it from a trauma-informed lens and not make people retell their stories over and over, or not pry into things that they maybe haven't told us yet. I think we've all worked in this field a long time. We sometimes think there's more to the story, but it's really hard to come right out and share your domestic violence story, right? Or how you ended up homeless because of drug use, because you relapsed again. So if people aren't ready to share those stories, that's fine. We help with what they come in with. And we're really, really happy to meet with community members and get a sense. We can't know everything, but I think all of us really like getting out into the community and meeting with different partners and brainstorming creative things. So where I will end it is, where there are opportunities to help. Like, hopefully you came here because you wanted to be given an assignment and be put to work. I'm sure that's what it is. But I came up with 4 ideas. If you have ideas of where else to present, having been in this position for a year, I am so surprised by the number of times people are like, oh, I had no idea what social services did. And we joke that I want to build a volleyball court in the abandoned parking lot, because social services kind of like, people think we're related to aquatics or the golf. Like social, come play beach volleyball with us. The county has said no, I don't get my beach volleyball pit yet. We'll work on it. But if there's other groups that may be interested in knowing what all is going on, what is social services doing, I would love to chat. I'm happy to take this out on the road. I have to get better at the projector part, but we'll get there. So by all means, let me know and connect me to whoever else should hear this. I put some of our collaborations up here, but if there's no way I'm connected to everybody. There's church groups I haven't met with yet. There's service groups. There's a ton. I just met somebody from the Rotary who's interested in building a ropes course at Veronica, and before that I met with Cecilia, who's doing a mutual contact who has this idea for a film festival for young people to make movies related to addressing the opioid use. Like, I'm in my mid-40s. I can tell kids not to do drugs all day long, but if they make the commercials, like, it'll be so much more impactful, right? So if there are groups that should have a community collaboration with social services, also connect me to them. Social services, us, I know we're 5 and we're little, we don't have a lot of volunteer opportunities, but I guarantee that all of our community providers could use volunteers. Shout out to the senior centers, I'll plug them, LA Cares, and all of them, but you guys are here. There's so much need. You saw the slide that I highlighted. There's such increased demand for services. So if you need help connecting with somebody, I guarantee I know all of our providers and can easily make that connection for you. But if you want to join the Health Council, we have vacancies on the Health Council, and I can explain how to fill out the application online that comes to me. But the last one is, if you have ideas for collaborating to improve health in our community, I am open to literally all ideas. If it involves maternal health, paternal health, grandparent health, mental health, all the intersections with all of those combined. We are fortunate to have funding to do so, and a county council that is really motivated to help fix needs. They're really invested in the healthiest community. I know we get that designation all the time, but that doesn't mean healthiest community for everybody. So how do we bring everyone up? There's a group of us working on it, and I would invite you to join us. 1 minute over. Thank you, thank you. As we say at council, I'm happy to stand for questions. Or you can just throw them out if you have ideas. Mara.
I have one. With budget hearings coming up with the county, what would your wish list be? What are the areas that you feel most need additional funds and maybe even groundwork to get them moving at this point?
That is such a great question. We've just completed the drafts for the budget. The budget hearings will be in late April this year. A couple of my wish list items. So if you're unfamiliar with the budget season or cycle, I'm a division within the Community Services Department. We are given guidance on how to make a budget, and then we kind of make our wish list, but we present it then to council, and then council kind of determines where the priority areas are. So, we're not just given everything, of course, but a couple of them, the requests that came from social services included more funding for that capacity building trainings so that we can have more people trained in suicide prevention, mental health first aid. There's an evidence-based training. The acronym is SBIRT, screening, brief intervention, and referral to treatment. So that's a mouthful, so we just call it SBIRT. But it's a way for people who are trained in mental health or other healthcare fields to get additional training in recognizing alcohol and substance use disorders. So I recently met with representatives from the medical center about doing a bigger training in SBIRT. So funding for capacity building trainings is one. One of the things that we had seen in the comprehensive health plan and at our offices has been related to kind of a lack of addressing some needs specific to older adults where they have fallen through cracks. So having a dedicated case coordination person to work with people over 60 when, for example, an EMT goes out to a house and maybe notices evidence of hoarding, or a code compliance call comes in, but it's a person who is living alone, doesn't have family in the area, can't keep the weeds maintained, et cetera, et cetera. Could we have a case coordinator to connect those dots for the specific group of people over 60? And then, helping carry out the comprehensive health plan from the Health Council. Thanks. And I forgot your name. Next.
Oh, me.
Colleen.
We did somewhat of a bubble up here. I'm a little wondering why no outreach? Why not no real coordination with communities around us? Because that's what I'm wondering.
Yeah. I think the answer is turnover maybe in my position. I think I'm the 4th social services manager in 2 or 3 years, and I think it just kind of fell through the cracks during COVID. And that's been one of the things I've been trying to fix, is meeting regularly with Rio Arriba County, with Santa Fe, and kind of building those relationships. My counterpart in Rio Arriba started the same time I did. Their longtime health and human services manager retired, and so he started, we both have been here for a year, so we're trying to build that relationship. And then I think one of the missing pieces of the puzzle is, for as data heavy as we are, a lot of this is still done on spreadsheets or emailing or calling, and so we're next week finally moving with a closed loop software that will connect providers in our community, but that same software is in place in Santa Fe already, in Taos already, in Rio Arriba, and then we'll have a much bigger net to connect people to. And I think that's been missing too. So it's a great question.
Albuquerque and Bernalillo as well?
Yes, and they're actually trying to make a case for it across the entire state, which would be amazing. So.
Hi, I have at least 2 or 3 questions. Maybe start with the easiest part. Oh, I'm Leslie. I'm wondering about the Motel 6 that's downtown. Since you're in the county, maybe you could figure out what's going on with that building. I don't know if it could be used for temporary housing.
It's being used, huh?
Yeah, I think it's purchased by a developer.
That's a development question for the county. It's
But
not,
she's very involved
it's
in
planning and zoning.
that. That's why I'm asking her.
If I had been here 2 years prior and been able to purchase that building, I know Santa Fe has been very successful at buying motels and turning them into housing, but that is not a county acquired property to turn into housing for county needs. Sorry. Yeah. If that was your easy question, what's your next one? Oh, geez.
I'm wondering whatever happened to the indigent health care fund that used to be based in this county. I thought the state took those over, and what access do you now have to funds like that?
We still have access to those funds. The state has, that's a great question. It's called the Safety Net Care Pool. I always say Safety Care Net Pool, which makes no sense. Safety Net Care Pool. All the counties across the state pool the funds for indigent care, and then it's redistributed back based on actual invoices. So we get the invoices from healthcare provided at the jail, for example, and the county pays those. So we have a quarterly payment to the state, and then we get reimbursed for the invoices that we submit.